In countries around the world, children and youngsters face risks to their mental health. According to the data, 19% of the 15 to 24 years olds often feel depressed or have little interest in doing things. For some, these risks are in the world of the child, in homes, relationships, schools, and communities. For others, the greatest risks come from the world at large, from social determinants such as poverty, conflict, and disaster. Despite a widespread demand for responses that promote, protect, and care for children's mental health, investment remains negligible. Especially children and youngsters living in low-income countries are not very likely to receive interventions to treat mental health conditions. For example, in some of the world's poorest countries, governments spend less than $1 per head on treating mental health. Different barriers prevent youth workers and duty bearers in general to work on mental health. 1. Stigma. Stigma and the discrimination that accompanies it prevents children, young people, and caregivers from seeking treatment and participating fully in their families, schools, and communities. 2. Coordination between multiple sectors. Coordination between multiple sectors, such as health, education, child protection, and social protection, is required to address the complex needs that occur across the mental health continuum and throughout the course of life. 3. Support. Only a tiny fraction of government and international development spending is available to address mental health needs. When resources are available, they are largely focused on treatment of mental health conditions. Mental health promotion and protection are ignored. More specialists in mental health and an increase of general knowledge about mental health are essential to provide promotion and protection services. 4. Need of parenting programs. Caregivers shape the world of children throughout the first years, providing a source of healthy attachment. However, for many caregivers, fulfilling this critical role requires support from parenting programs. In addition, parenting programs have also actively engaged youth workers and trained professionals, which is a critical component of scaling up these programs in low-income settings.